I spoke to an expert in elder care about seniors understanding their Medicare plans. Take a look.
Yeah, the WellCare Cost of Complacency Survey polled about over 1,000 seniors to find out more about their attitude toward their health care. And what we found is that despite it being the number one most burdensome cost of all their living expenses, they don't seem to comparison shop for it as much as, say, some of the other things like their internet service or their cable bills. And I think that's a real problem because they're not only leaving money on the table, but they may not be getting the best coverage for them.
Absolutely, yeah. There's you got to shop around on these things, and I hope that our viewers out there, it's not too late for them to check in on their Medicare options for 2018, right?
No, it's not too late. In fact, they have till December 7th to lock in the plan that they want for 2018. And I want to emphasize that it is a hard and fast deadline. December 7th by midnight, they have to lock it in. So it's not too late, but I certainly encourage them to start looking at things now.
All right. So once you're looking at things, that's I just recently did mine. I'm not on Medicare yet. I got a few years to go. But just looking at mine, I was looking at the low premium versus the co-pays. And is the low premium the best option for seniors in Medicare?
You know, it's a very complicated thing, and I'm glad you say that you're looking at yours as well. I'm on Medicare, and I am reviewing mine as well. And you have to look, as you know, you can't just look at the bottom line. Yes, premiums are important, but what about the deductibles that you then have to pay? And what about the coverage that you may not be having? For example, you may need vision care. Well, you have to make sure that you have vision care included, and that might add to the cost. Or you might need dental care, or then sometimes you don't get coverage for diagnostic tests like MRIs and PET scans. So if those things are important to you, you have to make sure that you're adding those in to your cost and not just simply looking at the bottom line, here is my premium.
Yeah, Bart, after looking at mine, it's one of those times where I'm really looking forward to getting older so that I can get on Medicare. But let's talk about, as we're closing out here, so a couple more tips for our viewers as they're getting ready to look at their Medicare plan.
Yeah, I do really want to emphasize how to really look at the whole plan. What was interesting to me about the survey is, first of all, over 60% of seniors do not review their plan annually. And I think that's a problem. As I said, you're leaving money on the table and potentially leaving money on the table and may not get the right coverage. So really spend the time to look at it. I know it's burdensome, and I know it's confusing to people, but if you spend the time looking at it, you will find that this is the kind of coverage you need. And you can get some great information available. Medicare.gov is one site that certainly people can go to. And you can search for the kinds of questions that you have. Also, costofcomplacency.com, where you can also get answers to your questions. And I like to emphasize that you can go to your local senior centers, where not only are you going to get the information, but you're going to have some help guiding you so that you are choosing the best plan for you. And then there's some other websites that you can go to as well. AARP.org, for example, has a lot. But the information's out there. It is confusing.
All right. Well, appreciate you clearing some things up for us there, Bart. You have a great day.
Thank you so much.
And you can thank WellCare for bringing that important information to you.